फिल्म है द कश्मीर फाइल्स, इसने एक वर्ल्ड रिकॉर्ड बनाया है पहली बार विश्व के इतिहास में।
मैंने सोचा नहीं था कि मैं किसी चीज में वर्ल्ड रिकॉर्ड तोड़ूंगी, लेकिन मैंने तोड़ दिया है।
वर्ल्ड रिकॉर्ड बनते देखना अपने आंखों के सामने बड़ी बात है, वो भी जलेबी का वर्ल्ड रिकॉर्ड।
मेरी कंपनी कैलबे वाटर एंड सोडा ने इंटरनेशनल बुक ऑफ रिकॉर्ड में अपना नाम दर्ज कर लिया है।
वर्ल्ड रिकॉर्ड की हैट्रिक बना के अपना नाम इंटरनेशनल बुक ऑफ रिकॉर्ड्स दर्ज करवा जा रही है।
Hello, I am Dr. संजय कुमार, चीफ सर्जन फ्रॉम सेंट्रल हॉस्पिटल नॉर्थ सेंट्रल रेलवे प्रयागराज। एक बहुत ही इंटरेस्टिंग केस के बारे में हम आपको बताने जा रहे हैं। एक पेशेंट ने ललिता रंजन 19-year-old female admitted to our hospital with complaint of pain in abdomen and distension. Distension was going increasingly progressive in nature, which leads to the discomfort and respiratory problem. Urgent CT scan was done, and CT scan showed large huge mass into abdomen, and urgent decided to explore the patient. Patient has a history of the exporting protein by transverse incision at the age of 6 days of the birth. With the help of the senior professor and former HOD, Dr. SHABI AHMAD sir, called for to attend this operation, and the further experience with the large huge abdominal mass will be narrated by the Professor Dr. SHABI AHMAD sir. Sir,
I am Dr. SHABI AHMAD, professor and former head of department Motilal Nehru Medical College, Uttar Pradesh. As an honorary consultant, I come to help and execute this surgery. This patient was admitted under Dr. Sanjay, who is the senior surgeon of NCR hospital. This patient actually had a huge abdominal mass with distension to the point that patient was in respiratory distress. We first utilized the previous incision of transverse laparotomy done earlier, and we have to extend this incision because through that complete transverse incision, the cyst could not be taken out or delivered. So we performed a lower midline T incision also to reach the lower border, and this was adherent to rectum, this was adherent to the small bowel. In fact, there was incidental finding that small bowel was in a cocoon which is known as the abdominal cocoon, and we somehow carefully dissected from the rectum, the great vessels, the ureters and the small bowel and delivered the cyst. After delivering, we could see that the pedicle was having big vessels which was carefully ligated. The uterus was saved. Due to endometrioma, the adhesions was dense, and in fact the pelvis, it was very difficult to remove it, and we could somehow manage to remove it, and the cyst was delivered, and the fluid contained inside the cyst was around 5 liters, and the size of the cyst was about 28.4 by 24 by 12 centimeters. Now we think that this is the largest endometrioma of the ovary because the earlier publication by the Japanese surgeon shows only 24 or 25. So this goes over by 2 to 3 centimeters. Patient is recovering fine, post-op patient is good, and she is allowed an oral diet and moving about ambulatory. Thank you.